Good morning, everyone. Thank you for joining us here on the KAMR Local 4 News. The City of Amarillo is preparing to have a briefing about the coronavirus pandemic. We're taking you live now there for this breaking news.
That requires face masks in public places now. I think the order does make us more mindful of our germs and covering our faces, which every mom and every teacher in the city would tell you is a good thing. I think I've been watching the response with just some interest, just watching Panhandle people respond, because I think Panhandle people are practical people. And agree or disagree with the order, I think as a whole, Panhandle people have taken a very practical response, a practical approach to doing what the governor has asked us to do. And we have a lot of work to do to get our lives back on track, to get our economy back on track. And I just want to say thank you. Thank you for spending your time working in your business. Thank you for spending your time investing in your kids and in your community. I'm glad we're not wasting time and energy on conversations about things that right now we can't change. And I think that reflects that character trait that we as Panhandle people really value, and that is just being practical. So thank you for that approach. I've reflected that there have been times in our history, both as a state and as a nation, where people have made great sacrifices in order to move through difficult times. And right now, face coverings are a sacrifice that we're being asked to make in order to move through a difficult time. And I think the practicality, as well as the community mindset of people who live in Amarillo and the Texas Panhandle, will equip us to do what it takes to move through this difficult time, including abiding by the governor's request that we cover our faces when we're out in public. I think we can do it, and I appreciate your support in getting that done. On moving forward, though, COVID is here. It's still present, and we're still addressing all of the needs that our community has with COVID, but we must keep moving forward on other city work. There are other city projects that are important and relevant to the future of Amarillo, and our city is determined to continue doing that work even in the midst of the challenges that COVID brings us. The Civic Center project is something that still needs our work. November is going to be here before we know it, and we'll be having an election on whether or not to move forward in investing on our Civic Center. I think that election is going to be very important to the future of our city, both our short-term future of making an economic recovery after COVID and our long-term future of offering the quality of life that we know we in Amarillo want to have, not just for ourselves, but for our children and our grandchildren, and for our local businesses to be able to recruit young executives and people in our workforce to stay and do the jobs we need them to do here in Amarillo. So that's something that we're continuing to work on. We're also working on a project for new water meters, and that's something that we'll have more information in the coming weeks. But as a citizen, I want you to know that's an important project to be getting citywide new water meters in the years 21, 22. And those water meters will help us conserve water, and they will give you as consumers a lot more control and information about what's happening with the water going in and out of your house. And then the last thing that I just want to mention this morning about work that the city is doing from the city council level is considering some changes to our city charter. It's possible that we might have some amendments on our November ballot that would touch our city charter. And so stay tuned for more information on that as the council receives a report from a citizens committee working on this issue and begins to craft whether or not to include that as part of our November election. So yes, we have COVID, and yes, we're going to get good information from these city leaders here today on the press conference about COVID, but it's not all that we're doing. And I know that you as a business owner, you as a citizen are also, you're managing COVID, but you're turning your attention and your direction back toward managing the things that are important to you in life. And the city's doing that too. So let's keep doing that together. I appreciate everything you're doing in our city to get us back on track. And that's all I have this morning, Dave.
Thank you, Mayor. At this time, let's now go to Dr. Scott Milton, Texas State University Health Sciences Center. Dr. Milton, how are you?
I'm fine, Dave. Good morning. I'm pinch hitting for Casey this morning, and I know I won't do as good a job as her, but let me just kind of summarize the numbers as of yesterday. Through 7/7, through the 7th of July, there were a total of 3,979 total cases and 3,535 recovered cases, with 46 deaths. This leaves 398 active cases. And although this number has decreased, we continue to see new cases in both counties, with a slight increase in positive cases more recently. And these are trending more towards Randall County than Potter County, it seems. So in summary, there's two important numbers that I'd just like to point out. The active cases have dropped significantly, and I think that that's more of a reflection of our hotspots and individuals that are finally recovered from that, which is essentially at least 10 days symptom-free, have finally reached that threshold and they've recovered. The other important number I think that we should realize is 46 deaths. Those are all tragic, but those have just barely crept up, and which I'm very thankful for. Now, that being said, we continue to see patients that are hospitalized with COVID, and these numbers seem to be increasing. And I think Brian and Mike will probably discuss this a little bit more, I'm sure. As stated previously, social distancing is the most important measure that we can do in terms of reducing the transmission of COVID. So please practice this, and please wear a mask as outlined by the governor's orders. Thank you, Dave.
Thank you, Dr. Milton. At this time, let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas. Brian, how are you?
Good morning, Dave. Thank you. Good morning from Northwest Texas. It is my sincere hope that this virus does not like triple-digit temperatures, because if that's the case, then by the end of the weekend, we're going to be in great shape. What I do know is humans don't like triple-digit temperatures. So I think myself and many of us will be moving indoors for the next week. And there's some good studies that have shown that you have a multifold reduction in the chance of catching this virus outside versus inside. However, standing out in 104-degree temperatures is not a practical strategy for avoiding this virus. So as we move indoors, we got to do the same things that the mayor and Dr. Milton have been saying for months now, which is wear masks, keep distance, good hand hygiene, wipe down, frequently touch surfaces with disinfectant, all those things that we know protect us inside if we can't be outside in the kind of temperatures we're looking at. As Dr. Milton said, we're looking around the state. There are clearly areas that are struggling with this virus right now, and I think it is encroaching upon Amarillo. So to give you an example, in terms of our numbers, a week ago this time, we were at 7 patients with COVID-19 in the hospital. By the 4th of July weekend, we were at 15. Today, we're at 18. Okay, so we are seeing an increase in the number of inpatients. Our ICU a week ago had 2 patients with COVID. Today, we have 8 patients with COVID-19 in ICU. 2 of them are on ventilators. So it is very clear to me that we are seeing an increase in our numbers in the hospital. On the outpatient basis, we're typically seeing 1 to 2 positives. With our testing in Northwest today, we're now at greater than 5 every day in terms of those tests. And then lastly, one thing we're seeing is we've had a number of our staff call in knowing that they've been exposed in the community to this virus. That means we have to quarantine them. So if you look around the state, most of these hospitals are saying, we're in good shape with PPE, we're in good shape with beds, we're not in good shape with staff. And that is our biggest threat, is to have our staff members quarantined due to exposures, particularly in the community, to this virus. So everything is unfortunately moving in the wrong direction in that respect. Now, one thing is we're talking about remdesivir. That's the drug we've been using. So we've been informed that we've received the last of the government issued allocations for remdesivir. Now we have enough to treat about 19 to 36 patients, depending on whether or not we do a 10 or a 5-day treatment. After that, we will be purchasing the remdesivir. Now, the cost of this drug is going to be somewhere between about $3,000 and $5,600 per person for treatment. So that's an expensive drug, let alone the hospitalization. So we'll be very diligent about what we're using right now, but we do see that cost coming in the future. With regard to PPE, we're in good standing right now. We are receiving requests from some of our sister hospitals in South Texas to send them PPE. So we know that they're starting to get in trouble, and we will be offering support for them. Right now, we're not going to change any of our visitation restrictions. We still have two visitors per room right now. We're not going to change any of our elective procedures right now. So we're full steam ahead on elective procedures at this time. And lastly, I just want to say my thanks to our staff. You know, they're starting to see these increased numbers. We're gearing up, going, here it comes again, possibly. And they're facing it with a lot of courage and conviction that they're ready. They're going to take care of the patients that need to be taken care of. But, you know, we always worry about the fatigue of the staff, like they're seeing in a lot of these other hospitals. And you know, we've got great people working for us. We want to thank them for all their efforts, and they're ready to take care of the people that come to Northwest. That's all I have. Thank you.
Thank you, Dr. Weiss. This time, let's now go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, how are you?
I'm well. Good morning. Thanks for having me on today to talk about what's going on at BSA Hospital. You know, I think that the theme is very similar here at BSA, as Dr. Weiss just mentioned, at Northwest across the street. And that is that, not surprisingly, I'll say that after the holiday weekend, after you know, some of the augmentation of our folks getting out and about, you know, we are having another uptick in cases. A week ago, we had about 18 cases in the hospital, and we've been running a little bit higher here than the low teens that we had for most of the month of June. Today, we're up to 27 confirmed cases in-house. Of those 27, 10 of them are in the intensive care unit. Of those in the intensive care unit, 3 are on ventilators. I looked back just to kind of get a historical viewpoint here of BSA when we were as high as 27 prior to today, and that was back on May 31st. We have not been this high since that date. And as you might recall from prior news conferences, we were at our peak on May 8th of 54 cases at BSA Hospital. Then we gradually diminished our numbers from that time forward. So hopefully this is a bump that we're seeing that is not going to be sustained. However, I think we're all cautiously being optimistic that that will be the case. We are happy to see that we're moving forward now with universal masking in public places. We do all feel that that is the best way to try to mitigate this disease. At BSA, we're obviously continuing with our masking policy. We are continuing with visitation restriction with 1 visitor per patient at this time. Depending upon what happens with numbers over the next week or so, that could change where we go back to red status, which means that we'd have no visitation except for very exceptional circumstances. We're not there at this time. We're trying to allow visitation in a limited capacity now still, so that folks can be with their loved ones when necessary. Remdesivir was mentioned by Dr. Weiss and also I think Dr. Milton. We so far have treated 22 patients at BSA with remdesivir, which is that antiviral drug that we know has been shown to shorten the course of COVID in patients with more significant disease. We also got our final allocation from the state of that medication, but we do have a fair amount left to treat, probably about anywhere from 30 to 40 more patients, depending upon the course of duration. We will be having to purchase that drug, as Dr. Weiss mentioned as well, and it is costly. We'll continue to use the appropriate process to determine who gets the drug, making the clinical parameters be the deciding factors of who will get the medication, which has been our process from the get-go. We also are continuing with elective procedures at BSA. One thing we are doing is paying a very careful and close attention to our ICU census and capacity. If there is any elective case that is potentially going to warrant an ICU bed, we are limiting those on a weekly review of cases to make sure that we don't have an issue with hospital capacity, especially for those intensive care beds. We are approaching volumes in the hospital that are near where our historical census is for this time of year. Obviously, the majority of which are non-COVID patients, and our staff is doing an excellent job handling those patients, nursing, physician staff, therapy, everyone who's on the front line of doing a great job with taking care of patients in the COVID and non-COVID realms. And the last thing I'll say is that from a testing capacity standpoint, we're in very good shape. We have a good inventory of the rapid testing that we can turn around within about an hour when someone comes for a test that's an inpatient. We start reserving those for people that are in the hospital. We're getting good turnaround on the outpatient tests that we send out as well, working with our colleagues down at different laboratories within the state near Austin that are helping us turn around some of those less urgent test results and really giving us about a 24-hour turnaround time. So again, overall, we feel like we are very well prepared with our surge plan. We've been surge planning for months. So if there is a second bolus of patients we're going to see, we're ready for them. And hopefully we're a little bit smarter, we're a little bit more efficient, a little bit wiser in terms of what we need to do to manage these patients most effectively. Thank you.
Thank you, Dr. Lemonier. This time, let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. First of all, good morning, Amarillo, the Texas Panhandle, and specifically our veterans within the Texas Panhandle. First, I want to share, I've been here a month as of today here at the Amarillo VA, and every one of these news conferences, I have said we have 0 inpatients. Not that we have not had COVID patients, it was just not at the time of the news conference. Whereas today, very similar to Dr. Weiss, Dr. Lemonier, is that's not true today. We have 2 inpatients. We have 1 ICU patient who's not on a ventilator and 1 up on our med surge floor. So we have seen an increase of that during this time. We do have 14 patients positive that are on home isolation, and we have 2 PUIs. We're awaiting their test results back that are also on home self-quarantine. And I do want to report we've had 14 recoveries of our veterans who have tested positive for COVID-19 in the past. Now, last week I had mentioned how I had made the decision to push to the right our reinstating of the non-urgent, non-emergent appointments to 20 July. We are continuing with that date. As of right now, I'm continuing to look at that 20 July date, although I continue to reassess based on what's going on in the community and what we are seeing amongst our veterans. And the VA itself has about 100 facilities across the country that have reinstated appointments. And so we are hoping to become one of those that have reinstated after July 20th. As I mentioned last week, we had several veterans who already had appointments booked to the tune of around 2,600. And those appointments we're still honoring unless it's requiring reasons that the provider looks at. And if so, they're calling the veteran and letting them know. I do want to remind veterans that when they do come here for appointments, that we are screening as they come in, including taking a temperature. We still have our no visitation policy in effect. We do allow a caregiver when that's necessary with the veteran. And even just yesterday, I visited one of our veterans in one of the waiting areas who had his daughter here who was his caregiver. Now, our pharmacy does do mail-out prescriptions with the exception of some medications. And we also have a drive-by service that is available when needed. And I would like to just remind the entire Amarillo area about continuing to practice those safe habits, echoing what's been said before, wearing a face mask, proper hand hygiene and hand washing, and practice your social distancing. And so once again, I'd like to thank the City of Amarillo and the mayor, and thank everyone for welcoming me to this area. And thank you for our veterans and what you do each and every day.
Thank you, Dr. Gonzalez. This time, let's now go to City Manager Jared Miller. Jared, how are you?
Doing good. Thanks, Dave. Just want to remind everyone, if you feel sick, you feel like you have symptoms consistent with COVID-19, want to recommend you call the public health hotline at 378-6300. You can be screened for the drive-through testing center. Want to go through some of the details on the governor's executive order 28 and 29, along with a proclamation that was made by the governor on the same day that GA 29 came out. All of those are in effect right now, and we'll also go over the ways that GA 29 modified GA 28. I'm going to go into a lot of super detail on that and can certainly respond to questions regarding any details or semantics with the 2 orders, but I do want to give some highlights on the 2 orders. GA 28 superseded GA 26. It's going to continue unmodified or continue until it's modified or taken away by the governor. So just briefly about the occupancy limits that are applied in GA 28. No occupancy limits on essential critical infrastructure, religious services, local government operations, child care services, youth camps, and then recreational sports programs for youth and adults. 50% occupancy limits on outdoor areas, events, or establishments for professional, collegiate, or similar sporting events, amusement parks, swimming pools, water parks, museums and libraries, zoos, rodeos, and equestrian events. Every business establishment shall operate at no more than 50% capacity. In addition to that, there was a number of businesses that were specifically highlighted. Restaurants moved from 75% occupancy back to 50% starting Monday, June 29th. Bars are closed were closed effective on noon of June 26th. They can continue to provide takeout or delivery of food and alcoholic beverages as authorized by PABC. Also, in GA 28, all outdoor gatherings in excess of 100 people were prohibited without the approval of the mayor in the city of Amarillo. In the unincorporated areas of Randall and Potter County, those events would require the approval of the county judge in those two areas. So with regard to GA 29, it was a standalone executive order from the governor relating to the use of face coverings during COVID-19. That went into effect at 12:01 p.m. on July 3rd. In addition to that, there was also a governor proclamation on the same day that reduced the local approval number for outdoor gatherings to those in excess of 10. So any outdoor gathering in excess of 10 requires the approval of the mayor or the judge in an unincorporated area of the counties. Now that approval process sounds like there would be a lot of calls to the mayor. So what the mayor has worked with staff to create a process by which staff could administratively approve those events if they meet certain criteria. So if the event is a already exempted event by the governor, for example, a religious gathering or something like that, it is approved. There's recommendations that face coverings and social distancing, frequent hand washing, and managing the interaction of people is done in those situations, but that is approved without the governor, without the mayor's approval. If it's not one of those things, then it must follow the Open Texas requirements from the governor's Open Texas report. It also has to meet our requirements, which simply require people to follow the governor's Open Texas report. In Amarillo, that's primarily going to be things like wearing facial covering, social distancing throughout the entire time of the event, frequent hand washing, and sanitation of frequent touch surfaces. Finally, if it meets all of those things, then it would be administratively approved. If it doesn't meet those things, very likely would be denied. So that's our way of making sure that we're addressing the requirements put in place by the governor and also allowing events larger than 10 to responsibly take place. With regard to GA 29, the governor's order on the face coverings, every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when they're in an outdoor space, wherever it's not feasible to maintain 6 feet of social distancing from another person, not in the same household. The face covering requirement doesn't apply to certain people in certain situations, and I wanted to touch on those very quickly. Any person younger than 10 years of age, any person with a medical or disability that prevents wearing of a face covering, any person while the person is consuming fruit or drink or is seated at a restaurant to eat or drink, any person while the person is exercising outdoors or engaging in physical activity outdoors and maintaining a safe distance from other people not in the same household. So both of those things have to be in place when exercising outdoors and not wearing a face mask. Any person while the person is driving alone or with passengers who are part of the same family or same household, any person obtaining a service that requires temporary removal of the face covering for security purposes. Once that security purpose is achieved, the face covering does have to be replaced after that. Any person while the person is in the swimming pool, lake, or similar body of water, any person participating in voting but wearing a face mask is still strongly encouraged. Any person who is actively providing or obtaining access to religious worship. But again, wearing the face covering is still highly recommended and encouraged. And then finally, any person while the person is giving a speech for a broadcast or to an audience. Not exempted from the face covering requirement is any person attending a protest or demonstration involving more than 10 people and where they can't or are not observing the safe social distancing of 6 feet from other people not in the same household. From an enforcement standpoint, following a verbal, and this is per the governor's order, following a verbal, written, or written warning for the first-time violator, a person's second violation can be punishable by a fine not to exceed $250. And also each subsequent violation can be punishable by a fine of not to exceed $250. From City of Amarillo's standpoint, our official policy is we're working to get citizens to voluntarily comply. If it comes down to it, and there is some egregious resistance and there's no compliance, they can take criminal action by making a report and submitting it to municipal court, or a summons to be issued, or write a ticket. To date, we have not submitted any reports. We have not issued any citations. We have had excellent participation from our citizens, and anytime a police officer or other official charged with enforcing the governor's order has spoken to people, they've been very readily compliant. So I want to acknowledge the good work that our community has done there. Also want to acknowledge and request that if you're approached by any official requesting you to do that, please know that they're working to protect our community and also to be responsive to the orders of our governor. So I really appreciate the assistance that everyone's provided on that, and any questions that I can answer on that, I'll be more than happy to do so right now. Dave, that's all I have.
Thank you, Jared. At this time, we're now going to open it up to questions from our media members. If you have a question for an individual panel.
All right, we'll continue with the coronavirus coverage on air and online. And to keep up with the latest, you can visit our website at myhighplains.com. For now, we'll send it back to regular programming.
Blamed mayors and county judges for not enforcing his orders and essentially causing the spike in cases. I spoke with the county judges who objected to that charge. I was just wondering how you respond to that.
The governor's comments, and I did not feel like they were directed at the local leaders in the Panhandle area at all. We've worked well with his office over the course of our tenure here in office, but also especially in the last 3 or 4 months during the COVID outbreak, we've worked directly one-on-one well with the governor. I think he's faced many tough choices, and as this pandemic has evolved, some of his leadership choices have also evolved, and I think it will be the best use of Amarillo's time and energy to look forward on what we need to do as a city to get behind his leadership. What do we need to do today as a city and as individuals that will make our state, our nation, a safer place, and getting behind his authority in a positive way with the mindset of how can we be part of the solution, I think is the best response to what the governor is asking us to do.
Thank you. My second question is probably for Jared Miller, but anyone can answer. So you said how you haven't gave any fines to people not wearing masks. So how do you know that it is being enforced and that it's the Amarillo Police Department that is enforcing it?
Well, it's not just the Amarillo Police Department. It's also Amarillo Public Health, Amarillo Environmental Health, the fire marshals. There's a number of people that are charged in different scenarios with enforcement responsibilities by the governor.
So then is anyone making sure that they are being enforced, or is it just their responsibility?
Sure. No, I mean, it's the responsibility of our citizens to comply with the order from the governor, obviously. But while we're not going and responding to calls of someone not wearing a face mask, we are, anytime there's an egregious situation or a situation where we have a large gathering, where obviously we have masks not being worn, social distancing not being observed, we're going to go and educate and work with them to find a way for compliance going forward.
Thank you. And then my last question is for Mayor Nelson again. You're meeting today with bar owners in town. Is there any flexibility that the city has for the governor's closures?
Well, we're going to comply with the governor's orders, and they're very clear right now that at this time, he believes the best course of action is for those businesses to not be operating. So what's important about the meeting today is that we have conversations so that concerns can be understood. There is a line of communication both from the city to the bar owners back to the city, and then there's a line of communication from the city to the governor's office and through our local representatives in the legislature. So those are important conversations to have so that people can understand all of the issues involved and hear all of the pain points that are involved too. And that's partly how the governor makes his decisions and gets the solutions in place, is by listening through these local officials and the representatives that represent these businesses, both through the Bar Owners Association and their elected officials at the statewide level and a local level.
Thank you. That's all I had.
Thank you, Morgan. This time, let's now go to Aaron Langston of KMR Channel 4. Aaron, how are you this morning? Good, how are you?
Can you hear me fine?
Yes, sir.
Yes, yes, we have absolutely have had similar scenarios where, staff members, employees of the hospital have had community exposures, even attempting to do the right thing with proper masking and avoiding gatherings, et cetera. The nature of this virus is that it's insidious, and that is that the potential to acquire it is not going to be difficult. But so yes, we've had individuals that have had community exposures. We've had to quarantine them, and quarantining staff is one of our greatest concerns as well, in terms of reducing the potential workforce that is qualified, trained, and licensed to take care of these patients. So we are asking our folks to be extra diligent when they're out and about, just like we're pleading with you all now as a community, so that we can protect one another. And we're also pleading with folks that if you're having any symptoms, if you're having a febrile illness, if you're having GI symptoms, respiratory symptoms, cough, shortness of breath, and there's not another obvious reason why you're having those symptoms, I will tell you that you should assume you have COVID and you should get tested promptly. And the reason is that the likelihood of that being the case certainly exists. And it's not that you can't have another virus, you certainly could. But based on the prevalence of this infection in our community, you need to right now assume that you could have it, get tested, and then follow the appropriate instructions from the Department of Health or your employer regarding how you should be quarantined. But that's not an issue. That's not an issue now. I mentioned earlier during my update that we're at about 50% of the max COVID volume we had in the beginning of May, and at that time we felt like we could have handled a bigger surge as well. I think both hospitals are collaborating well in terms of how we're handling these patients. I think our city is prepared to handle a larger bolus if it happened. And again, there have been discussions with the state regarding what we would receive in terms of additional help if it got to that point. So I think we've had these discussions with our state leaders, representatives, our city leaders, Dr. Nelson, Mayor Nelson and Dr. Milton have both been on these discussions
I just
with
got a
us.
promotion, I think.
And we feel like we're ready to handle a bolus if it comes. So again, hopefully it doesn't, but we feel like we're ready if it does.
Yeah, I would say the same thing. I think, when we talk to some of our hospitals down in South Texas right now, most of them have had the time to somewhat hoard PPE. So that's not become a limiting factor. It is the staffing. And unfortunately, that is where, Dr. Lementier said, all it takes is an exposure, a moderate high risk exposure, and someone's got to bow out for 14 days. And so that is still our biggest fear is getting a situation where we've got beds, we've got PPE, we've got all the supplies we need. We just do not have the humans to help take care of their fellow kind that are licensed. Because as Dr. Lamentier said, you cannot rapidly replete nursing staff. These are people who have spent years of training, are licensed, and so that's the limitation is we deal with who we have right now.
I don't think there's any specific information as to why that would be the case, other than the fact that these people are the healthiest and out in the community the most. And I would think that would imply that they tend to have activities that would increase their risk of exposure. Yes, and that we repeat that all the time. Please wear a mask. Please wear a mask, and please practice social distancing.
If I just say, there's Dr. Burke, who's the dean of the Texas Tech School of Medicine, wrote, to me, it was a very thoughtful article for the paper the other day, talked about, that even though younger people tend to be able to shake this off pretty easily, is if you knew that you put your grandparents at risk or your parents at risk or people who are at higher risk, and you knew that you had exposed them, just how difficult that would be to know that you harm somebody. And I think that's the biggest thing is it may not be for yourself, but be for the people around you, those that maybe are more vulnerable than you, to do those things that we know prevent you from contracting this virus and then spreading it subsequently.
Thank you, Aaron. This time, let's now go to David Gay of the Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. My question, I know that Dr. Lamentier spoke about this in his statement, but with the cost of remdesivir, will the process of determining which patients who will receive the treatment change whenever hospitals have to purchase the treatment rather it being distributed by the state?
I would say that no, that process would not change. I think that we've always made those decisions based on who we think was actually going to benefit from the patient the most, from the drug the most.
Absolutely. And is there a timeline of when, I guess, each of the hospitals believe that they might have to start purchasing the treatment rather than, or the state allocated remdesivir running out?
David, I would say we don't have a timeline. And I think both hospitals are very similar in that we probably have enough to treat upwards of 30 to 40 patients at each facility. But certainly, as we start to chew through that, we're going to, because there's always that question: will it be available for purchase? And just what is the supply? So sometimes you've got to plan for weeks ahead to try to get this in. So talking to our pharmacists, we're still kind of in a holding pattern. But I think if we start to see our stocks decrease, absolutely, we're looking to purchase it.
Absolutely, that's all the questions I have. Thank you, guys. Have a good rest of y'all's week.
Thank you, David. This time, let's now go to Paula Albaran of Amarillo Telemundo. Paula, how are you?
Good, thank you. And you?
Very good, thank you.
Good. Okay, so my first question, it will be for Dr. Brian or Dr. Michael, and it will be, have you seen an increase of healthcare workers infected with COVID-19, or it has been stable?
Well, I would say we've seen an increase, and it's all been community contacts. It has not been hospital acquired. So yeah, so we have seen that over the last 1 to 2 weeks. We've had more nurses report symptoms or significant exposures in the community.
Yeah, and I would share that. Analysis, and that is that yes, although the composite of where staff are getting infected certainly could be a patient exposure or community exposure, the community exposures are on the rise, and it's obviously because the prevalence of disease in our community is on the rise. It appears, and across the state, if you will, across many of the southern states in our country. So yes, we've seen more community exposures. We've had to quarantine folks as a result of that. We have done some pretty aggressive testing of our staff whenever there's a potential exposure to other workers, and fortunately, the overwhelming majority of those tests are coming back negative. And then we proceed with our quarantine process based upon the timing of their exposure and when their test was negative. So it doesn't totally get you out of the woods if your test was negative. You were tested early, but it certainly lets us set up the framework for when we can get you back.
Okay, thank you.
I'd just like to add to that. Last week we discussed this issue about how it seemed to be that it was actually safer to be in the hospital than in the community, and that is because we are demanding that everyone wear a mask. And it's just a testimony to how masking works and personal protective equipment works. And so everyone needs to keep that in mind in the community, that this is effective. This will help prevent cases from spreading. Thanks.
Okay, thank you very much. And my next question is for Mr. Jared Miller. And you say that no mass citations have been issued, but have you heard of any warnings issued by the city, the police, or any other agencies here in Amarillo?
No. I have not heard of any law enforcement agency or any other governmental entity employee charged with applying the governor's orders, issuing any citations.
Okay, perfect. And thank you very much. Those were my questions, David.
Thank you, Paula.
Do you know if anybody's issued any warnings?
Yeah, we've talked to people, but I don't know the numbers of those. All of those interactions have been extremely positive, just like when we were working with businesses when we had the very low occupancy limits and much more restrictive policies for separation and things like that. When we worked with those businesses, they were very, very open to compliance.
Thank you, Jared. At this time, let's now go to, if I'm not mistaken, Ariana Martinez of News Channel 10 KFDA. Am I correct there?
Hey, David, it's Bonnie with News Channel 10.
Hey, well, how are you?
Thank you all so much for your time. So my first question is, are there any plans for retesting hotspots like nursing homes and meatpacking plants?
There are no plans to retest those facilities, but obviously that would be on we would assess that as time goes on. My belief with the packing plants is that they have maybe gotten closer to herd immunity than other places, and so I hope that that's going to mean that those problems are somewhat behind us.
Got it. Okay, thank you. Also, how successful have contact tracers been with this, increase in cases?
Well, I think the health department's done a really good job of scaling up or scaling down in terms of having the personnel available to do active contact tracing. And as of the numbers today, we have fewer active cases as of right now. And so that's going to be helpful to the health department. So I think overall, we've done a fairly good job of staying up with that.
Right. And lastly, y'all just mentioned that getting a negative test doesn't mean, that you're completely out of the woods. How can someone know if they are, completely recovered, or how is someone designated as recovered?
Essentially, we like people to be symptom-free and about 10 days, at least 10 days from the time that they were exposed. I think that's a safe number.
Okay. And okay, sorry, one more question. Has the speed of getting test results changed? Increased, decreased?
Yeah, I can. Say I can respond to that for the hospital, Dr. Milton. And that is that, we have a machine here at BSA that does our reverse transcriptase PCR, and it's a very rapid turnaround. It's the rapid testing that myself and Dr. Weiss and Dr. Milton have talked about. And for inpatients, for people that need the results back quickly because of the acuity of disease or trying to determine who needs to be wearing the maximal PPE, we're using that testing platform. So the results are back within an hour. Otherwise, we're sending tests out to places like CPL down in Austin. I've had multiple conversations with their leadership this week, and they are doing an excellent job of turning our tests around, most all within a 24-hour to 48-hour time frame.
Got it. Okay, well, thank you so much all for your time. I appreciate it.
Yeah. At this time, those are all our questions from the media. This concludes our weekly news conference. And once again, we do these every Wednesday at 11 a.m. I want to thank all of our panel members who took the time out today to participate and provide this valuable information to our community. Thank you for your time. And this is David Henry, Communications Manager.
Hey, nice job.
Thanks.
We will see everybody
I'm gonna
next
drop
week.
that thing into your end drive.
Good job. Thank you.
Thank you.